Hi everybody, I am so excited to do this video today. Today is July 23rd, 2017, and today is my 6-month surgiversary. I've been so excited to do this video, and I've actually tried to find different locations because it's a beautiful day out, and I really wanted to do it outside because you know, we live next to a place that's called Roaring Camps Railroad, and you can hear like the steam, you know, coming out, and it's like, I don't know, it just, today's like one of those beautiful days, but I can't find a spot to do it because we have some construction going on, and so we don't have a good flat spot. So I'm so anxious. I just had to sit down and just do this video. Okay, so I have so much to talk about. I'm in such a good mood, in case you can't tell. So anyway, where do I begin? Okay, January 23rd, 2017, I had vertical sleeve gastrectomy surgery at El Camino Hospital in Mountain View. My highest weight that I had ever seen on a scale was 261. My highest weight recorded was 257, and that was actually just 1 week prior to surgery. Surgery day, if I recall correctly, I was like 251 or 250 or something in that range. I did lose 6 or 7 pounds just in the week prior, just from that pre-op diet, which was shocking to me and probably to everybody, how much weight you guys can lose during that pre-op phase. So anyway, where am I at today? So I am officially 190 pounds. So for my highest weight ever, that's 70 pounds gone. So excited. So excited. But for me, yes, I think the scale is important, but I think other milestones are also important. So I have jotted down a few changes that have occurred to my body since losing weight. Okay, number one, my shirts and my tops, my blouses. I used to be as high as a 3X. I was more of a 2X, and I had just gone into the 3X realm when I had surgery. I now wear a size XL, not a 1X, like an XL. I can fit into size large, but it's just, and maybe this is like a part of the weight loss thing, is I kind of have some extra skin like on my back, and it kind of shows a little bit if the shirt, I'm sure you guys have seen this too, but, or will see it if you haven't got there yet, is kind of bulgy like in the back of my bra, and I don't like that. And so that's why I opt to just stick with XL for now. Okay, pants. My highest pant size I ever wore was 20 women, so 20W. My average was 18W. Well, now this one's gonna be a little bit confusing for me, because I just realized this, is I had, because of my weight loss, I mentioned in some prior videos that I had kept some clothes because my weight gain was very abrupt, and it was medically, had medical reasons for why I was gaining weight. I always had that hope that if I could get my medical stuff in order, I would be able to lose the weight, which didn't actually end up being the case. I had to have surgery to lose the weight, but I had that hope. And so I had saved a lot of my clothes, and it was only 5 years ago or 6 years ago where I was a lot smaller. I was more like my size now, actually, because I hadn't even thought about this, but so I had packed away those clothes, and those clothes now fit me. So that, I'm kind of having like a light bulb moment, and it's like that's actually that's kind of like that's crazy. But so I'm now wearing size 16 pants. However, I kind of question whether or not the sizing, you know, have you guys heard of that that sizing called Vanity Sizing, where they'll call it a smaller size even though it's a bigger size? I'm not sure if this maybe was the case, but all the clothes that I'd pulled out from my my boxes, they were all size 16. They fit perfectly. Like, and I have all different brands I'd bought from all different places. I mean, I had like 10 pairs of pants. So I thought, okay, I'm a size 16. Well, yesterday I went into a shop and I was trying pants on, and I tried on a pair of size 16, and they were huge. So I don't know. Is it possible that the sizing changed in 6 years from like this used to be size 16 and now this is size 16. I don't know. So, but the pants that are physically on my body that I'm wearing are ones I bought 6 years ago. They're size 16. So I don't know what the size would be. If it maybe be a 14 in today's sizing, or if it was just that store. I don't know, but around 14 or 16 maybe. Okay. Shoe size. I used to wear a size 8.5. I don't anymore. I now wear a size 8 shoe. Bras. Oh my gosh, bras. Okay. I used to wear a 44D bra. Okay. Which the D part definitely didn't bother me. The 44 part, it did, but the D part didn't bother me. I am now wearing a 38C. But I'm a little kind of bigger. So what I really need to do is probably go get sized, I guess. Because, you know, to get a good fitting bra, it's kind of one of my challenges. But anyway, that's probably TMI. Anyway, but you know, I'm in such a good mood. I mean, I could tell you guys anything and I'd be fine with it right now. I mean, I'm an open book. Anyway, and so from my highest weight at 70 pounds, and I think hitting this milestone for me, especially today on my 6-month surge anniversary, it's just amazing. I'm so excited. I'm really, really happy. I wish I could do a body shot, but you know, I don't think I could really pull it off like right this moment. But maybe like I'll do another video and maybe try to change the camera around. Something else, like guys, I really want to talk to you guys about. I have been using that PatchMD for my patches, and you know, I'm about to do my 6-month post-op appointment. So they did a ton of blood work, and I told you guys if I would give you guys an update, and I gotta tell you, all my labs are perfect, totally perfect. So let me show you real quick. I take, for the PatchMD, because it's a patch, you stick it on your body. So I've got the multiple vitamin, if I can speak. I do B12 energy every other day or so. This one, it keeps my levels really good. I don't know for me personally, because I'm still kind of a sick body. I still have a lot of autoimmune issues, and so my energy level is always really, really crappy. So these, I was hoping that they would kind of help, but you know, maybe they are. Okay, I use this one, the menopause. I have had a hysterectomy. I'm only 42 years old, and I don't take any estrogen replacement, because I also have endometriosis very badly, and estrogen feeds endometriosis. And endometriosis is an extremely painful thing to have. That's why I had a hysterectomy. So it's a terrible thing. But you know, my girl part's kind of slack-a-lacking, because I'm only 42, and my body is not realizing I'm only 42. And I'm happily married and want to act like it, if you know what I mean. Okay, anyway, I also take the iron, or use the Iron Plus patches. These, I don't use them every single day. I only use them every other day, but my iron levels came out like perfect. There was not a single test that she ran that came out negative, except for that, and it was not related to patches. I had to do a 24-hour urine collection test, and it was for the, I'm not sure how to say it, creatine, something like that. That came out a little tiny bit high, but I guess that's really common for people that have had rapid weight loss, which I suppose I have, 70 pounds in 6 months. I think that's pretty good. Okay, and the last thing I'm going to talk about today, hair. So, you guys know when I first started doing videos, I always wore my hair up in clips. And so my hair color and my hair, it was kind of probably a little bit harder to see. Then you remember for Mother's Day, my children were awesome, and they took me to Ulta, and I got this amazing haircut. Well, I just got my haircut yesterday again, and I had them cut it a little shorter. I'm really liking it. What do you guys think? But something that I've noticed, so I suffer from a really pretty severe thyroid disease, and it's called Graves' disease. And I also have, because of my Graves' disease treatment, I had a total thyroidectomy, which you can't tell, but I've actually had my thyroid removed. So I'm not, my body can't create the thyroid, so I'm on thyroid replacement. So I'm technically, I don't, so in order to find out if you actually have what's considered Hashimoto's disease, Hashimoto's is a autoimmune disease. It is basically the polar opposite of what I have, which I have Graves' disease, which means an overproduction of thyroid. So it's an overactive thyroid for Graves' disease, and Hashimoto's is an underactive thyroid. But because I have no thyroid, I have low thyroid levels, but I don't know if I have Hashimoto's because my doctor doesn't think there were, I mean, it's kind of a conflict I have with my doctor where you have to do like an antibody test for that, and he doesn't see the benefit of doing that because what difference would it make in his opinion? Where I would like to know, but anyway, I'm sidetracking. So I have to take thyroid replacement. So I do take a very high dose of thyroid replacement, but I have consistently been losing my hair, like spot loss, since I was 30 years old, and I'm 42. So I go through periods where when I'm a little bit sicker, where I lose the hair, I get a little bit more stabilized and I get the hair back. And then I guess typically I lose hair from thyroid disease here, this area right here. And you can see that right now I do definitely have, it's kind of hard to tell in the video. The video is doing me, is being kind, but I actually do have a little bit, but I have some baby hairs kind of growing back. But that's my thyroid hair loss area is here. Just in the past 2 weeks, I have noticed huge clumps coming out. So my hair is very thin now. It's very, very thin. When I had actually the other day, I'd washed my hair and I actually kept the clump because I was going to do a video about it, but then I got home and my husband had found it and he was just like, ugh, he had thrown it in the garbage, which I don't blame him. But for me, what it really, that was like really the first time where I was like, oh my gosh, I'm losing weight, or I'm losing hair because of my weight loss. This isn't just my thyroid disease anymore. So not only am I losing my hair from thyroid disease, but I've lost some from the weight loss, I think. The one thing I have not done is I haven't done any sort of biotin or any sort of replacement. But something that I wanted to mention. So if you look at, I'm sure you can't really tell, but my hair, even though I've lost a great deal of it, I don't think it's ever been this healthy. And my theory is that what I've been losing is actually the unhealthy hair, and what's left is very, very healthy, enough to where I don't think I'm going to do highlights again. One of the reasons I would do highlights in my hair is because my hair, this kind of dirty blonde color, it would look very dingy, and it would look like, it always looked dirty. Like even if it was freshly washed, it had no vibrance, and so it looked like I needed to wash my hair. Now my hair, it's so healthy, and the color is so wonderful that I think, like I said, I think all the unhealthy hair has fallen away, and this is just nice healthy hair. So I'm actually pretty okay with it. At first I was like, oh my God, I'm losing my hair. Because like you brush my hair and I have to like take out a big clump. And this is honestly, I'm sure I was losing a lot of hair before, like in the past few months, but I really attributed that to, it wasn't like an abnormally large amount. It wasn't like, oh my God, look at all this hair. It's just in the past literally 2 weeks that I've been like, oh my God, look at this hair. It's terrible. But yeah, so I'm actually kind of seeing the benefit. So anyway, I don't want to get this going too long, so I'm going to say goodbye. You know, please, if you're new to my channel, or if you kind of, come in every once in a while, please subscribe. I so appreciate all your guys' support. I can't even tell you how much it means to me. Okay, guys, have a great rest of the day. I'll see you later. Bye.